Ontario is the first province in North America, and probably the first jurisdiction across North America, to set up ER wait times targets and public ER wait times reporting. So we are setting standards that I think hopefully are world leading, if not continent leading, in getting access to care for our patients through the emergency department.
As of September 2012, the majority of Ontario patients, 86%, received treatment in our emergency rooms within provincial targets. Time spent in the emergency room has decreased overall by 13% from April 2008 to September 2012. Complex care patients have received the greatest benefits, with their time in the ER being reduced by 22.4%.
All the departments in the last 5 years have improved the wait times because we've improved staffing, we've added on nurse practitioners, physicians assistants, we've added geriatric emergency nurses to help the elderly, we've beefed up our mental health programs, we've added more doctor hours, pharmacists, so we've increased the amount of infrastructure. We've really focused on improving our processes and procedures. We streamlined all our departments so that there's fast-track areas in all our EDs so that people with minor problems can be seen sooner and faster, which frees up resources for the more complex patients.
We've done some things like educating physicians and staff. We have teams in the emergency department that will help to improve processes. They do flow mapping. They look at, for example, things like what's the medication history that this patient has had in the time before they've come to the emergency department. It's a safety issue. If we know that medication history and the best practice for that medication history from a safety perspective is to understand the pharmacy pieces that the patient has been on, the medications, and so forth.
It's easy to see that when you're talking wait times, you're really talking quality. You're really talking about all the handoffs for the patient throughout the system, and focusing on quality removes waste, removes time, and really improves the system performance for all the patients.
And so you just don't work on the one tire of the car without working on the entire vehicle, for instance. And so the LHIN recognizes this. And so we're going to work on trying to improve the entire system to create flow, not just through hospitals, but key is improving access to primary care. So there's more access to primary care after hours, so patients can go to the primary care practitioner instead of going just to the ER, and so we can free up some resources to help emergency patients.
We're managing chronic disease better. We're focusing on that 1% of the population that is generating 34% of the cost to our system. We're focusing on improving mental health for the entire region. We're focusing on improving our connections to primary care.
And very importantly as well, we realize that we have a very increasing growing population of senior citizens, and they're surviving healthier and longer into their older ages, and they require more complex care, and they require more in-depth care at home. So we want to keep them healthy and safe at home by expanding and coordinating the services that provide for them, such as CKHA, home care nurses, and we want to tighten the connection between primary care, long-term care homes, and the hospital, so that we provide care where it's needed at the time when it's needed.
There isn't one silver bullet that will solve this, but what there is now is that being local allows us to work with all the sectors and to engage everyone to deliver on the promise at the back here about better care, better experience, and better value for the taxpayer dollar.